KSCASI Surgeon's Time. And we have the topic from hype to hospital, practical applications of AI to the modern general surgeon. And respected dignitaries of KSCASI, past president of, past chairman of KSCASI, Dr. Shivaram sir, who's a moderator today. Dr. Past chairman, I think he's not joined, Dr. Rajgopal Shanai, Dr. Rajshekar Sijaka, Dr. Sharat Tanga sir, Dr. Sunil Joshi, Dr. Sangamesh, Dr. Dinesh, and all the Dr. Sunil Kumar, who's going to give a talk today. Welcome you all to this important program. And we have all heard that the hype, that is the promises that the AI is going to give it to us. That is from folding our laundry to writing our memoirs. But tonight we are moving past from this FM hype, that is foundation model hype, to the high stakes of reality, to the operating theater. And we are the powerhouse we have is Dr. Sunil Joshi, who has coordinated this program. Dr. Sunil Kumar, who will be the speaker, and who likely spends more time of his debugging the future as much as it does in the operation theater. And Dr. Shivaram, always the man tasked with making sure all this cutting edge technology actually cuts where it's supposed to. And the floor is all yours. Please, and you must, at the end of it, tell us whether AI is just a fancy GPS for the gallbladder, or are we truly looking at the end of the human error in the operation room? Over to you, Dr. Sarvesh.
Yeah, Dr. Sunil Joshi.
Yes, sir.
Yeah, please.
Good evening, everybody. It's an honor and privilege for me to welcome our moderator to the meeting today. He's none other than Dr. Shivaram, a dynamic leader. He's been past chairman of our KSCASI. Currently, he holds a post as national EC member of ASI, and he has lots of initiatives that have been adopted by ASI. One of them is the Surgeons Week and the Surgeons Day that we celebrate today all over the country. And the recent one is Healthy Surgeon and Healthy Nation concept, which is accepted by the ASI all around. And we recently did some programs in his leadership. So without much ado, sir, I'll welcome you to moderate the session on this wonderful topic. Thank you.
Thank you, Dr. Sunil. Respected Chairman, Secretary, Treasurer, and all the office bearers of the KSCASI, it's a great privilege and honor for me to chair this very important session where we are at a stage, still some of us wondering whether AI is hype or it is there in a reality. And to bridge the gap between the hype and the practical aspects of it, whether it is pre-operative workup, intraoperative progress of the surgery, or the post-operative care, everywhere AI tool will be definitely used. The question is whether we will adopt it to our advantage, or whether we will allow the AI to take over us. And there is no other person other than Professor Sunil Kumar, who is the head of the AI mission in the ASI also, and he has done a lot of research work on this subject. It's our very happy privilege to have him today, and I'm sure he will take us on this hype or practical approach for the AI solutions. Thank you, everybody. I request all of you to keep muted and post your questions in the chat box, especially postgraduates. Don't hesitate to put your questions on the chat box. And this is your future, and definitely you require more knowledge about AI, and all of us also. Thank you, everybody. Let us listen to Professor Sunil Kumar.
Just to interrupt here, Dr. Sunil Kumar is the lead for of AI in the ASI. So just to inform you all about it. And we are proud to have you, Dr. Sunil.
Thank you, ma'am.
Yeah.
Good evening to one and all. Thanks for the hype given to me. So today we are here to see whether AI is the hype or are we scared of AI? Because we have both spectrums of people who are scared of AI, that AI will disrupt the normal whatever system we are having. There is also reluctance of acceptance of AI into our clinical practices. So today we are going to see whether AI is all the hype or it can be brought to the hospital for practical usage for a modern surgeon. So I am Dr. Sunil. Greetings from ASI, Karnataka State Chapter and Central, and also from Bangalore and my alma mater, Bangalore Medical College. Thanks ASI on the outset to give me this opportunity to present this topic today. So what we are covering today, we are going to demystify AI briefly. I'm not going to take a class on AI. So today we are here to discuss about the topic of bringing the AI to the surgeon practice. So we are going to discuss some preoperative uses, intraoperative uses, and also a little bit of post-op, and how it can impact on training. And we'll discuss some things about AI. And we can't shun away from AI programs from ASI, that is AI for Surgeons mission. So we'll few minutes of that program also. So I have been asked to keep the talk little short so that we'll have more time for discuss. So I have kept my talk as short as possible. So let's start. So AI, we need to understand the word AI should be used as a co-pilot. Co is important in this word. Pilot is always we, you, me, or anybody who's using AI. So we all know that aeroplanes have been put on autopilot mode and there are co-pilots. So whether the co-pilot is running or even for an extent the autopilot is running, pilot is the in charge for flying. So that is the bottom line that we need to understand. So we should always take AI as co-pilot. We should not rely on AI for anything, whether to make a decision, and especially in healthcare, we should never rely on AI for treatment or any part of management, especially diagnosis and treatment. So the goal of this session is to not make you a AI scientist or AI entrepreneur or a AI surgeon. It is just to keep you better informed so that the surgeon is a AI enabled surgeon, AI augmented surgeon. So that is the modus operandi for today. So before going directly into the AI, just a brief about what is artificial intelligence in its own world. So what is artificial intelligence? It is an intelligence which is artificial, that is computer system generated. And the intelligence is mainly based on reasoning, pattern recognition, and decision making. So here the keyword to understand is pattern recognition. So suppose today, now, if we take up the WhatsApp and we type G, the WhatsApp suggests us the word good morning or good evening or good night, depending on what time of the day it is. So it takes the timing for its reasoning, and it recognizes a pattern of our the typing, and it makes a decision that the suggestion is good night. Or if you take a message and start a new line with H, it will suggest you to type have a good day or have a nice sleep, whatever. So that is how the artificial intelligence reasons out. It reasons with our background knowledge, what we have typed earlier, and it recognizes the pattern and it makes a decision. And that is its decision. It is suggesting us. So that is the decision to type the same word or to change a word is always with us. Then there are some words called machine learning, which is very commonly used. What is machine learning? Machine learning, the name itself tells it, the machine is learning. What it is learning? It is recognizing the pattern, what we are teaching it. So it is not learning by itself. We are teaching it. We are teaching WhatsApp what we are typing. We are teaching Google what we are searching. We are asking ChatGPT what we want to see. So ChatGPT knows us. It does not know the whole world. So it is learning about us mainly. So that is how it is learning, and then it predicts. Then there is another word which is commonly used, which is computer vision, which is in healthcare very commonly. What is computer vision? It is a vision. So vision is mainly it is seeing. So it is learning here, it is seeing here. So what it is seeing, any images, any videos which is in the healthcare, it is seeing and interpreting this image. So this is where the radiology is been having a great impact, where all about radiology is about images or videos. So obviously it is learning better in radiology world. Uh, Being surgeons, we know no two abdomens are same, or no two inguinal hernias are same, no two gallbladders are same. So obviously AI has more difficulty, or we need to teach AI more than anybody to make it more useful. So that is computer vision. There are many other things like used cases. So many commonly confused terminologies. Used case, don't get confused with used case means. Usually in AI world, the used case means example. So in common terminology, as we tell, for example, so like that in AI world, they use a fancy term called used case. So since we are clinicians, uh, uh, case means we always think it is about patient. It is not about patient. Any AI engineer also use the word used case for metaphorically for telling to tell it as example. Okay. So next we will see why now we are talking about AI and Indian healthcare. Because as we know, Indian healthcare is at inflection point. Inflection point means it is at the timeline where it is changing very rapidly, very rapidly. And India is a land of change, and it is changing for good. So main reasons for India being at the top of AI change is we have data explosion, because we have n number of data. We all know the health tourism is at peak in India, because we have very good doctors, very good healthcare setup. Even though the developed countries call themselves have developed, the healthcare is much more developed in India, because the intuition, the human intuition is more in India, because we are trained with volumes and volumes of patients and labs. So the human intuition, what the Indian doctor has, is not replaceable by anybody. So it can only be competed, or it cannot be, means you cannot question the human intelligence. Majority of the global associations or global societies, when they want to make a high impact to the whole world, they rely on developing countries like India, because we have more exposure. So our data is very high. And we all know that in daily life, surgeon to patient ratio is shortage. We have a shortage. Yes, we might have more surgeons in cities like Bangalore or metro cities, but in tier 2 cities, tier 3 cities, definitely there is shortage of surgeons. Shortage of doctors per se, but being surgeons, I'm only talking about surgeons. So in tier 2 and tier 3 cities, there are a lot of people who are waiting for getting operated, and the surgeon visits and does some 10 cases, 15 cases in a day and comes back. So that is still going on. Though we are in 2026, we still have significant shortage of specialists. And what is the AI hardware we require? We do not require a robot which costs crores of rupees. We do not require an extra gadget that we should buy to use the AI. We have phones in our pocket, we have laptops, we have computer systems which are installed anywhere. So all you need is a little bit of interest into AI, and having guardrails to use it, and some knowledge about AI, and you start using, and automatically most of the AI applications can be used by surgeons to make himself a better surgeon who's AI augmented. So as we discussed, surgeons, not radiologists, not data scientists, are best placed to lead this change because we understand, because we see the organs, we feel the organs, we touch the organs. So we know, we can understand the disease pathology better. We can understand the process better. So obviously, we can understand what we exactly need for the AI to do for a better healthcare. Obviously, most of the means I keep talking to many people that most of the AI courses are run by data scientists who are not doctors. So their perception of healthcare is totally different than the doctors themselves. So when the solution is provided, many times we do not know whether the solution is really the solution for the problem which we face. They might have perceived something as a problem which we do not really feel that is a real problem. So that is how surgeons are at very important point of this point of change, so that we understand better and we can make AI better for our society. So how we can use? We can start from pre-operative phase, starting from OPD. We all know many things have come to our rescue that we can record. Many of like the current meeting is being recorded, and one click of a button, we can get the transcript. Whatever we are speaking, whatever discussion happened, since we told we welcomed each other, AI, the Zoom AI knows who is talking, who is listening, and who asked the question. And it exactly can tell at 8:05, it started, 8:06, this happened. It can also give the subheadings of my talk at the end of this. So that's how the AI has come to general health. So obviously, can we use it for our usage in OPD? Definitely we can use. We can use to centers, high volume centers, government centers like us. We have a huge crowd in OPD sitting and waiting, and there many times they are fighting also that they came first. All those things are there. And what we are doing is we might see a patient for 5-10 minutes, and we are going to write the same patient case history for another 10 minutes. So we are wasting a lot of our time in non-clinical usage in OPD, like writing, and we have to replicate the same thing to the lab investigations. We have to write in particular form and give to the patient. We have to write a radiology form. We have to write a pathology form. We have to write some microbiology form. So all those is being replicated. We don't have that sticker system, barcode system. So we have to write everything. So can we use it for that? Definitely we can use it and make it more useful so that we can save time. Each minute saved per patient. Suppose you are seeing average 100 patient or 200 patient per day. 200 minute, even minimum of 1 minute saved per patient, we can save 200 minutes. That's a significant time each day. So if you think of per year, it is like months together we have saved. So that's how we have to see in planning. So we all know in the rounds, there are many systems which classify each things like ASI grading, Apache system, POSSUM, Alvarado scoring, many scoring. Even like very common thing, pancreatitis, we have Ranson's criteria, modified that, modified this. But how many of us are really putting the scoring system and telling this patient is mild, this patient is moderate? We still go on our human intuition that he looks mild, he looks sick, he appears that he is probably very difficult to see tomorrow. That's our human intuition. We take pride in telling that I told it, I identified it. But are we really putting the score system and telling he is at moderate risk and he is going to be in ICU for another 2 days? Are we really doing it really daily practice? Yeah, many might be doing, but not all. Definitely not all. But like institutions like ours, PGs are having dissertation topics, but are really PGs doing this work? I doubt it. Means I honestly tell many PGs might not do it. They will come and copy later. Once a patient is settled, then they will come and copy later. They will put the scoring system. So can we use AI? Definitely. You all know the answer. Once AI is integrated, you just enter. By the time you finish, already it has put 10 scores, and it is given according to this score, he comes under mild. According to this, the prognosis is good. According to this, the prognosis is bad. We all have many things which can tell us, sorry, by our thought, we might think it is mild, but all the systems are showing that it is moderate or severe. Definitely, we have to see that are we doing right thing. So what is the AI prediction rate? The accuracy of AI is around 85%. It is not human intuition which is telling. This is in the literature. The literature tells that if you use AI, the prediction accuracy increases by 85%. So are we really ready to tell that we are better than the literature? We can always tell that we are better than AI. We cannot tell we are better than the literature. Literature proves otherwise. So instead of resisting, we should use to our benefit. All that AI is doing is to make a better surgeon. So why to resist that? We can use it for preoperative prediction. And we can always use the same thing for getting a good consent, giving a good example to the patients, or giving good comforting words to the attenders, and telling the prognosis better than what we used to do. So that's what we can do. Can we use it for our lab reports? Definitely. As a surgeon, many of us might not be in a position to read a film, which is a CT or a MRI. We all know that we require a CT for staging. But suppose there is no report with that CT film. Are you stuck? Yes, many of us are stuck because we might not know how to read exactly what is that fat plane, where is that really that fat plane stranding, or how much of reaction is there, what is the pointer which is telling inoperability. We might not exactly know. Yes, some people might be knowing, but on a large scale, we are not really equipped with that knowledge. Can AI help us? We are not taking the diagnosis from AI, but if AI can tell there is something wrong in this film, in this area, we can concentrate on that area. Definitely, we can use it. And many things like discharge summaries, referral notes. We all know how funny the referral notes will be. Kindly do the needful. So we don't know what the intern is writing, what a resident is writing when he's sending to some other department. When other department receives our referral letter, they are seeing that surgeon is not able to manage this patient by himself, so he has sent to me. So what is the thing that he has to see? It should be mentioned. Suppose if you just kindly examine this patient and do the needful, he has to do the whole thing. So can we write a better referral letter? Definitely. We all know that to write some letters, we have used ChatGPT or Gemini or Claude. So can we use it not to write a common letter? Can we use it to write a discharge summary? Definitely we can use. Suppose when we write a case sheet, instead of starting with a methodical name, age, gender, suppose if I know a patient and I will ask him, how is your father? How is your family member? And then ask, okay, how is other things? Then I'll come back and ask, okay, I forgot what is your age. Then I will talk about treatment. So if I do alternatively, I'm not going methodically. If I'm using a AI scribe, AI will put it in an order and give it to me in a good consultation notes. Or I need not write exactly there which column what to write. Whatever things are there, if I give to the AI, it will prepare a good discharge summary. I can see it, approve it, and then give for print. The word of caution here is we should not upload any of the patient identifiable data. So what is patient identifiable data? It might be name, it might be a phone number, it might be an email ID, or anything which can be told that it is belonging to this particular patient. So patient masked data should be uploaded, and then we can get the discharge. So if we cannot upload anything from the patient, how can we get? We can get only the we can develop a template where it can take it and put it in that particular point and give it a summary. Template can be generated, which can be AI generated, and automatically everything goes there. So that we can do. So this was a pictorial representation of a crowded OPD, and no doubt that is AI generated me, because since we are online, I cannot use others' photos or videos without permission. So I take liberty in developing my own videos, and that's me. Which is very, it's not a real photo. It's AI generated. It's a crowded OPD, and morning I'm worried that so many OPD and I have little time. It happens to every one of us. So it's not to tell that I am tensed. It's to symbolize that most of the surgeons, when we visit in the morning, we have certain amount of pressure and anxiety seeing the OPD. What if it happens like that? So that's what we are aiming at. We want AI to help us so that we can do a better job, like talking to a patient, giving the treatment instruction to the patient, so that instead of burying ourselves with paperwork, we can do better job. So digital assistant can be the AI even in the operation theater. How it can enter the operation theater? So already we discussed computer vision. So we all have monitors. We have laparoscopy monitor is there, robotic monitor is there. Many of our open surgeries are also being recorded. So once it is recorded, once it is digital, it can be accessed. And it can be, we are not recording the, we are, obviously we are putting the drapes on our patient. The patient is not identified, and then only we are recording. So there is a recording of a OT procedure, and that becomes a digital companion or a digital assistant. Instead of keeping it as a record, we can use this for our betterment. We can use that for our surgical growth, the technical growth. So that can be done. Obviously, AI comes in picture. So very commonly used example or used case, as it is told, is cholecystectomy. Cholecystectomy is an extensively studied surgery globally, and because it is a commonly done laparoscopic procedure, and it uses laparoscopy and it uses monitors. So what can AI do there? We all know, anybody is worried in cholecystectomy is bile duct injury, and we all know safe cholecystectomy program from ASI, AMASI, SAGES. Everybody is about cholecystectomy. So what if the AI tells us that it is giving a picture, something like that, on our monitor, that this is a safe area and that is an unsafe area? Means if you are going to that area, suppose AI tells us that it is unsafe, don't go there. Definitely, are we at benefit? Definitely, we are at benefit. If we go real proximal to a portal vein or a right hepatic artery, if it tells it's a red zone, definitely we are more careful. Means already we know that no two gallbladders are same. We don't have the same Kellogg's triangle in all the patients. If the Kellogg's triangle is predicted and told this is how it is, even without, we do not need a Rubina or a ICG to identify that. AI has learned through many videos, and it is learning day by day. If it can tell us, definitely it will be of much use. And suppose for teaching or even for any surgery which is not routine, or even for routine surgeries, suppose if the AI tells, like it is there like a silent WHO checklist. Suppose if we cut off the surgery into many parts. Suppose if we cut a cholecystectomy into 5 different steps, and at each step there is a side checklist on the monitor, and after finishing each step, if there is a tick mark on the monitor, can it be a good thing? Definitely, it will be a confidence boosting for the surgeon and also the onlookers or the trainees who are standing there. Each step is confirmed. Each step is done. You are not bypassing any step. So if you are doing a inguinal hernia surgery, you exposed this. Did you expose fully, or you are not exposed fully? Did you see the cord? Did you reduce the hernia? Everything is steps are there, and if it tells that this is checked, definitely we are in a good thing. So we are saving time, we are saving anesthesia, we are improving the health of the patient. Can it do anything else? Like already we discussed, it is monitoring the duration. It is seeing the duration. Suppose we are spending half an hour in Kellogg's triangle only, and the system flags that you have spent 30 minutes. We can always, a surgeon can take a pause, or he can call for help, or he can reassess that what he is doing is really right, or he can always take a change of decision, like he can go to a open surgery, or he can have an extra port, or he can change the settings, something like that. So can it be done? Definitely it can be done, because it is reading everything on the monitor, including the time, including the duration, everything. Can it do a never near miss prevention? Like suppose you have done surgery and the surgery has went on well, and when you see the footage, somewhere we feel that I could have done better. It happens. Suppose AI tells that you have done better in these things, and there are some constantly you are not doing better in some areas. Definitely we can learn from that, and we can improve ourselves, and it will become definitely a good teaching material for all the residents. And in all the cases, if you see, the AI is only the alerting fellow. He is not there to stop. He is not making the monitor go blank. He's only alerting the surgeon. Like in the seminar, at the last 1 minute is their paper presentation, you ring a bell. It's an alert. It's not stopping. It's an alert. So it is only the alerting authority, not the stopping authority. So how we plan for a complex surgery. Like many of us are doing routine surgeries routinely. Suppose you are doing some unique surgery, or you are doing some uh, 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 unusually large mass you are taking out, or you are not seeing something which is not routine. That what we do usually, we go to YouTube and see any such things are there. We Google it and see literature. We go to PubMed, or some of the residents who have no interest in Google, they might go to ChatGPT, Perplexity, Grok. So many things are there. We have n number of AI platforms. They will go there and try to learn from there and plan. So what a surgeon usually does, like a tumor board or a surgical scrub list, which is practiced in many hospitals, they will plan the surgery like today, tomorrow we are going to do like this, and after this step we are going to do like that. So that is a methodical way of doing the things. Suppose we come to a stage where we can plan a little better like this. We all know that it is digital. So suppose if I can be like Iron Man, I can project the organs in air, or I can project on screen and rotate it and see what is behind, or what is the part which I'm going to take. Can I do some preservation? Can I take it off? Definitely we are in a better position. Definitely we are in a better position. So can we help others? Suppose I'm interested in AI and I used AI very much. Can I help others? Or can a non-AI surgeon get help from an AI surgeon? Definitely it can be done, because it is a digital era. We can, like even in Karnataka, our DME madam is in process of getting something called CSM, Collaborative Surgical Module, where suppose we are at the pilot project is supposed to start at BMC, Bangalore Medical College, where the hub will be there, and all the tier 2 and 3 cities and all the medical colleges will become spokes. And suppose somebody from far rural area somewhere asks that tomorrow I'm going to do a lap cholecystectomy for first time in my life, kindly be there with me. I cannot physically go there, but I can be there online for him. Whatever he sees, in his monitor. I am seeing here. So I can always annotate. I can put an iPad will be given to me. Whatever I put there, I will put a pointer there. He sees the pointer in his monitor. And I'll tell, go there. Don't go here. So if I put some red mark there, don't go there. It's very dangerous. And he knows. So even without physical presence in his OT, I am there. So that can be done through artificial intelligence. So that gap of urban versus rural can be bridged. And it is a specialist who is there. It's not an amateur guiding from here. He's a specialist. So he is getting a direct specialist help somewhere in rural India. And we can also use it for guidance, operative interpretation. And we can also use for conferences, real-time surgical workshops, all those things. Can we use it for assessment? We all know that we have been assessing the students, or we are judging the papers, we are judging poster sessions, we are judging videos. So we are doing all those things. But somewhere we know that we are giving importance to how well he is prepared, how well he talks, how well he has come prepared, like physically, how he has come prepared. All those things are there. But a good surgeon might not be a good orator, or a good orator might not be a real good teacher, or a real good teacher might not be a real good surgeon himself. So all those things, we are not giving importance. We know the person, we are biased. We know he is son of somebody, he is brother of somebody, he is close to me, he has worked with me, we are biased. So can it be bridged? Definitely, we can put, these much points are there, you give this much marks. This much points are there, this much duration is there, you can give this much marks. So like in laparoscopy, we have endo trainers. So suppose he is moving too much, he is handling the tissue with a lot of force. He is not using one hand, he is using only one hand. Suppose he is not completing the area for a certain amount of time. All those things can be fed to the AI that can give a objective versus subjective assessment that can be useful for teaching. So all we are telling is AI will not replace us. Definitely, AI is artificial. Artificial can never replace natural, that is human. So surgeons who use AI definitely can replace those who do not. So we can't be that fox or wolf who did not jump to the grapes and told it sour. We have to jump, catch it, eat it. If it is sour, let's all tell it is sour. If it is sweet, let's enjoy it. That is the bottom line. All we have to understand is. So how we can get into AI if we are not getting to it? Suppose somebody is telling, I don't know what is AI is. AI will take out all my bank account. AI will know all my Aadhaar card. If somebody is really bothered that AI will not know about you, let me tell you, AI will know. However you do, your Aadhaar, your mobile is already in public. So nothing is held secret. So we can use AI. We can start using small AI tools, which is clinical. All we need to see is we should not let the AI learn about identifiers. So we'll mask all the data, we'll use it, and then we will demand evidence. We will not trust AI. We will only treat it like a house surgeon, or we will a junior most resident under us. So whatever he tells, however confidence he has, we will not trust. We will stay critical and we will lead the change. That is what we are at this point now. So that is the take home message which I need to give. So a few words about AI for Surgeons initiative. So yeah, this is the mission ASI 2026 AI for Surgeons program roadmap, which was submitted to the All India central body. And we had a mission and we had a vision. What is the vision? To integrate artificial intelligence as a standard tool It's not a recommended tool, as a standard tool for enhancing precision, safety, and surgical education, positioning ESI as a global leader, not Indian leader, global leader. ESI is already an Indian leader among surgeons. So what is the mission? Mission is bridging the gap between the traditional surgical practice and modern computational intelligence through structured training, not through one-day course or one-hour program. It is a structured training, collaborative research, where we all come together and have a nationwide awareness. That is the mission of the program. So we need to know something called Sahi. Sahi is a correct word in Hindi. Sahi. Sahi stands for Strategy for AI in Healthcare in India. So that is a national rule book which has been made. We will not know full about Sahi. We need not at this point. So what is Bodh? Bodh is benchmarking of open data in the platform. So untested models are there. Daily we are getting many apps. Many apps are there. Many applications, website applications, AI applications are there. So it will all go through Bodh platform, which is developed by IIT Kanpur, and it will become a vetted program. It will become structured program, tested modules. So why we are talking about Sahi and Bodh? Because our Prime Minister, Mr. Narendra Modi, has told something which is very interesting in AI Summit called Manav. Manav stands for moral and ethical, means the AI should be moral and ethical, and it should be accountable, and for governance, it should maintain the national sovereignty, and it should be accessible to all, and it should be inclusive to all, not exclusive to some people, and it should be valid and legitimate. So valid and legitimate, and it should have all these things. Then only it is taken as a good AI in India. Currently, it is an official thing. So we need to know Manav. So that is why the AI should be Manav. So it should go through Sahi and Bodh. Then only it will become Manav. So that is what we need to know. So the AI for Surgeons program has integrated Sahi, Bodh, and ABDM. We know Ayushman Bharat Digital Mission, which is again a central program, which is there in all over India. So it is Ayushman Bharat, which is a insurance cum data repository. So all these are integrated for this mission ASI. So these programs are taken care of. So it is like the ASI and Government of India are having a symbiotic AI presence in healthcare, so that we will tell the Government of India what is right in surgical platform, how it can be right for surgeons, how it will be good for patients. That is the program. So I'm not going in detail about the program. I'm just giving a bird's eye view. So we all have discussed already, the workflow can reduce, decision can be better, both in clinical and administrative decisions will be better. And we all know that it will be a digital backbone. That is, we have a lot of data which can be unstructured and become structured. And it will be, obviously, all the programs will get ABA integration. There are many acts which an AI platform should go through, like DPDP Act, and there are many other things that they have to go through, and they will go through that once they become public. And we have many of our, like Karnataka State ASI has its own website, which is maintained, and ASI has a digital app, and many other state chapters have their own websites. So what if a repository is created in our Karnataka State ASI website, that all our videos are being put there, and we can search for videos instead of going into YouTube, which is a open channel. If we go to a surgeon's own channel and we see, I want to see Shivaram sir's video, I want to see Naz man's video, anything like that can happen. It will be definitely better. So that is the plan for AI for surgeons. So what is the roadmap which we have planned? So the inception started in early January and February. So currently it is in process of standardization. That is, a manual is being prepared, and all the states will roll out in next month or so. This month, the ASI has asked for me to give multiple talks for all the state chapters so that all are in the same page. So all states will start rolling out the program in the next month. And we will all have some hackathons, some competitive based programs, and some innovative programs in the later half of the year. And we'll all meet in Ahmedabad, that is ASICON, to showcase what and all things we have done using AI, what and all things we have done to the AI, and what and all things we have done by the AI. And we'll culminate in Ahmedabad to showcase the work. So that is the plan. And the ASI tagline is Vayam Seva Mahe. We are there for the Seva. So we are looking at AI ready surgeon, who's a future of Indian healthcare. We are not there to resist any change. If it is good, we are going to embrace it and make it better. In the meantime, we'll also become better. That is the plan of action. And the future of surgery lies in our own hands. Instead of seeing at somebody else what they have done to the field of surgery, let's see that what we can do for the surgery, what everybody can collaboratively have to the surgery and do. And the tool which we are talking today for that is artificial intelligence. So let's start using artificial intelligence as our pet, as our child. We'll make it grow, and we will also grow along with it. Thank you. That will be end of my talk. So I'll be happy to take any questions if I can answer them. Thank you.
Thank you, Dr. Sunil.
Sir.
Wonderful talk. Can you remove your sharing? Yeah.
Yes, sir.
You can see all
Yes,
the
sir.
people around. So there are a lot of questions.
Yes, sir.
Before going to questions, I just want to ask you practical approach. So
Yes,
you're
sir.
sitting in the OPD and you want to AI to make notes and write all the history what you are taking in the OPD. What tool we should use?
Sir, currently there are many medical scribes, sir. Surgical Society has partnered with Cellstrat, which have their own scribe, and Eka Care is there, which is having their own scribe. But all AI applications, they work on different business module. So how they start is they will give something called tokens. So we will be getting, for any AI, it is free to use for certain amount. Even ChatGPT has the same thing. So if you start using we can use like 4 or 5 cases per day free of cost. If we like it, we have to pay. So it's like giving a sample. So they all give a sample so that we can test it, taste it, and then we can buy it.
Are
So
you using any of them?
Yes, sir. We are currently trying to the Cellstrat one we are using, sir, for as a pilot. So we are seeing how we can make it better, and we can use it. Like even we have tried using common things. We can usually make a Google call, a Google Meet call, or even WhatsApp. You can just open and keep it on the keyboard. There is a mic button. If you keep the mic button open, it will start transcribing whatever we speak. So suppose we have an hospital where we have to type. All these things can be typed on WhatsApp itself. So we can use any voice to text module to use it, but we have healthcare modules which are being done, sir.
Oh, that is
But
okay.
anybody, a word of caution is anybody uses medical scribe, kindly use them with questions before that. Have they passed through DPDP Act, and what is the certifications? If you ask about the certifications, the people who do not have certifications will be unaware of it. So obviously they will ask what certifications. If they ask what certifications, that means they have not undergone any certifications. So kindly ask them, are you certified? Are you DPDP Act compatible? So that is the
because there is a lot of legal aspects also
Yes,
for
sir.
all this. We can't disclose the patient's
Yes,
identity,
sir.
their photos, or the operation theater videos, all these
Yes, sir.
things. So coming to, see, you have recorded everything. You want to send the patient home discharge summary. So can you ask the ChatGPT to polish or make a finer copy of discharge summary and check the spell, everything, and give a final polished version of the discharge summary?
Yes,
With,
sir. That we
that is
can
with
do.
masking the patient's identity.
Yes, sir. That is the good way of doing. But always we need to see that who's responsible for the discharge summary is the signatory, that is one who is signing. We cannot tell ChatGPT has made mistake. So suppose if we tell ChatGPT or the whatever AI platform we are using, it can it makes mistakes when there is some numbers involved, sir. So if it is a dosage, if it is age, if it is calculation of some dosage, we cannot rely on any AI platform for calculation. So calculator is more common. It's more accurate than AI. If there are numbers, mistakes are more. So
Yes.
it can make the drug dosage very difficult to rely on. So, but good thing is even without telling, if you are asking for it to discharge the patient, it automatically gives some extra additions like keep yourself well hydrated, have good soft diet. So without telling, it recognizes that it is discharge summary and it acts as if it is discharging doctor, and it adds these things.
Right. So we have another 10 minutes.
Yes, sir.
So Dr. Naz is asking whether we have used AI help for this PPT presentation.
100%, madam.
Yeah,
100%.
yeah, lot of videos, everything, and
The videos, yes, it looks nice to see our own videos being developed. But to tell you exactly, I took almost 1.5 days to develop that small video clip of 6 to 7 seconds. I had to give 6 pages of prompt and give a lot of money also to develop that video. So it requires time, and yes.
yeah. So she's also asking whether it can edit videos, operative videos.
No, sir, no, man.
It can assist
it-
in editing
Yes.
videos. That is there, I think.
Yes.
Many of the
Video
software-
editing is a different ballgame, madam. So photo editing is very easy. Actually, if you start editing your own photos on any platform, it will edit to a certain extent. Suppose if you put your own child photo, it will tell child photos cannot be modified. So there are some ads which are already been in place. So it will stop. Suppose I want to see my daughter as a doctor, and I want to put her a white coat and stethoscope, and I will ask it. If it identifies it as my daughter, it gives, but it will not give if I give somebody else child. So there is a checkpoint there. Photo
Right.
editing we can do.
Yeah.
Video editing currently no.
No, video editing, AI assisted tools are there in
Yeah,
many of the
tools.
software.
Yes,
Yeah,
yes.
AI assistance can be taken. So Dr. Sunil Joshi wants to know, in India, documented data is high, personal experience is high. Means you want to ask which one is higher?
So
is that?
no, sir. Sunil said we have lots of data, but unfortunately, it is not documented, or it is just a personal experience that we speak.
Yeah,
Yeah.
yes.
So
yes.
it was yeah, that was the comment.
Right. Dr. Sangamesh wants to know, should accuracy be 100% with AI?
No, so there is no medical 100% anywhere. So as
Yeah.
we all know, we don't want AI to become 100%. So interestingly, my own PG wants to do a project which is AI-enabled surgeon versus non-AI-enabled surgeon. But I am kind of resisting the study because ultimately we are going to prove that AI is better than surgeon. So I don't want that to get published.
Yeah.
So we don't want that also, and we cannot rely. It
AI
cannot be
cannot be
100%.
100%. It should not
Yeah.
be. And also it
Should
can
not.
hallucinate.
Yeah.
It all depends on
I did not go in
how-
detail about these things.
Yeah.
Hallucination is one very important thing which limits AI usage. Suppose you can all try that you can just put what are the KSC ASI guidelines of 2024 about AI usage. You can just type it on any platform. It will give guidelines. It will give one-page summary. Or if you ask, give more detailed report, probably it gives 10-page report. And we all know that KSCASI did not have 2024 AI guidelines, but it is hallucination, and it gives with a lot of confidence that anybody can easily trust. Yes. So we have to be very careful.
Sarvesh wants to know, AI may promote dependency.
Yes, sir. Yes,
Yeah.
it is. It is making a like. How many of us really remember more than 4 or 5 mobile numbers? We do not remember because we do not use it. So if we become more reliable on AI itself, we do not have our own self reliance. So definitely, so we need to have a balance. We cannot rely more on that.
Yeah, AI is addictive, Sunil.
It's very addictive. Yes.
Very addictive. You may use it for all your, even for mail also, you can use it for polishing it, making it spell check, everything, and your articles, and you want to write an article, you will get referrals,
Yes, sir.
everything you get. It's very addictive.
So
Then,
many people have started using AI for writing articles, but after a few things, they will feel happy. But we all know that they will never get published because it will not be in a good form.
correct.
And all the journals have got AI plagiarism check now, and COP guidelines are there. So they will go through that and they will get rejected. But what happens as a byproduct of the, more usage of AI is they will stop writing themselves because they are become so dependent on AI. They will stop writing. So that is a very
Stop
bad thing.
writing and stop thinking.
Yes, yes.
Correct. Sunil Joshi is asking, recording a OT video can be mapped to a patient by AI, and surgeons got into trouble recently, medico-legally.
Yes, sir. That was the trouble was about the photograph. The photograph background had something.
Yeah,
So if you are recording videos, either we have to enter the patient's data manually to that monitor. Unless we don't enter, AI will not pick it up. If we enter the data manually, then only it picks up. Otherwise, patient identifiers are masked, sir, usually.
right. Calligraphy, Dr. Nas, that is well-known human assistant actually. In medical education, there is a need for objectivity in assessment. Which AI tool can help? Dr. Sunil wants to know.
So now currently, RGHS itself is doing some tools, madam. They are developing some tools that it is going to come in future that it will tell. First phase, obviously, the MCQs will go into AI because it's easy for the AI to market. Then the main problem is we have to guide the AI that which answer is right. We cannot have a question like inguinal hernia and write 10 marks for it, or inguinal hernia 2 marks. So whatever he can write etiology also, he can write management also. So we need to be very objective and we have to give the answer key guidelines to AI. Then only we can ask it to become more objective. Till that time, AI cannot become.
Dr. Sangamesh wants to know, can AI work without algorithms?
Yeah, there is a far fetched AI tools are there. Very interestingly, it will be surprising to know that AI have their own social media. So the social media for AI chatbots are there. There, the AI chatbots will talk about AI chatbots and the news. Like today's news will be a topic and they themselves will do it. You are not doing anything. They are there, but currently they are there for fun and for research. But yes, many of us don't want that. So obviously there are many guidelines for it. It's not become self-reliant.
Right. So there are a few more questions in that. Are they similar to the software we use for hospitals? Softwares will be integrated with AI so that
Yes.
it is more useful.
Sir,
For
AI,
hospitals,
I will tell you, AI is not very new. It started in 1950s. 1950s. Only recently it has become more talked thing. The AI, if you just take a ECG strip, there is PP interval, PR interval, QRS complex, which is there already printed, and it will also give query right bundle branch block or sinus tachycardia. That itself is AI. It is reading the ECG and it is telling that there is a possibility, though the doctor will not read that part, but it is there. It was there from beginning. Now only it is come to a little higher thing.
hospital EMR, they can be integrated with
Yes.
AI. What about environmental hazard? I want to answer that, Ravi, Sunil.
Environmental, directly AI doesn't have environmental hazards, sir, but indirectly electronic gadgets that can have. But
Yeah.
otherwise, yeah.
Professor Sharad wants to know video, 6 pages prompt plus 1.5 days. Can the practical details be shared? Which app?
Sir, multiple apps I've used, sir. There is no one app. If we
Yeah.
use one app, it's quite costly.
Right.
So, yeah.
Very informative talk. Comment by Dr. Manjunath. Cost of a app and maintenance.
So it's how you are using,
Depends.
sir. That's all. Means,
It depends on
as
so
sir
many
told
things.
rightly, it is very addictive. So sometimes you go on shelling out money and it becomes very costly. So it depends on how is your usage.
Correct. Can AI co-author be used for publishing? Very interesting question.
Sir, it cannot be taken as co-author. The author is always a human. Current guidelines tells what is the level of AI usage in that article. Most of us cannot tell that there is no AI usage because we are using AI for grammar check or syntax error or
Correct.
formatting, whatever. So we have to declare that
Disclose.
what is the amount of AI usage I have done. So that
Yeah.
is mandatory in majority of the journals, standard journals.
So power consumption and water guzzling are the environmental hazards, Dr. Sharad is telling. I think with this, time is up. Let me stop here and request the office bearers of KSCASI to take over and give the final comments. Thank you. Thank you very much, Sunil. Very informative
Thank you, sir.
talk.
Thank you, sir.
2 comments I had. One was that the slides were quite crowded.
Okay.
So it was difficult for us to read or sometimes.
I didn't want anybody to read, sir.
Didn't want anybody to read.
Yes.
So then I think you should have had some points on the slides and remove all the things. And
we have
AI-generated
but
videos
also-
and photos, everything was good. And that was
Yes,
a good thinking for others to take the message also.
I have a small comment.
yes, sir.
Yes, Dr. Sharma.
Yes, sir. Yeah. Dr. Sunil, it was a good talk.
Yes, sir. Thank you, sir.
I have been attending also the National Board of Examinations, conducted a AI program. I think
Yes,
we
sir.
had the 12th module recently, yesterday.
Yes, sir.
Now, the point with is this, for people who are interested, who have that inclination, they have had a bird's eye view of what are the applications, likely applications, because we still are in the sort of neonatal period of AI application in
Yes.
health sector and surgery specifically.
Yes, sir.
Most of it, what we are talking, yeah. So if you compare this with the internet era, okay, it will have a same trajectory as internet era would be.
Yes, sir.
So internet would be one thing we always talk that telemedicine could be, the game changer, but it never happened.
Never.
Okay. Same way, even with AI, whether that trajectory it will take or not, it is for the future to decide.
Yes, sir.
Second thing is, in slow period of time, because you're going to also have it in the AI, the ASI meets and etc. If the talk is restricted to this part of the information, it will go into a fatigue mode.
Yes.
Already in the 12th module, people are not connecting to it.
Correct.
Because most of it, what is being spoken of is what is being done in US and the commercial aspect of it. So somewhere during the talk, what would be a requirement for people like me would be how it could be incorporated in the surgical practically. I think Dr. Shivaram had a very valid point when he subtly spoke about it. What is that practical app which we are going to use to take the history in OPD?
Yes, sir.
Legally, every key aspect of AI will be challenged unless we have our own data bank. Okay. But these aspects, if they are incorporated, it will add more value to the talk. Otherwise, it will go into a fatigue mode. What,
Yes, sir.
as you are there, even subtly when I asked about video, whatever you can share about that video creating, what app you used, what needs to be done, if that is not shared, then the same thing, it will go into fatigue mode. This is my small, it being a bit more direct, upright,
No
because
problem, sir.
after 12 modules there, I feel I have gone into the fatigue. I just
Yeah.
don't want, I don't want to drop out because at the end of the day, I want to have a course certificate.
I've stopped
A
attending
lot
it,
of
sir.
irrelevant things are there in that course for surgeons. It's not for
Yes, I
not very
say,
useful.
Sir, as rightly told, sir, we have 12th module you are attending. So you are on one side. There are many of the attendees today also that probably they are listening for AI for the first time also. So
agree.
yeah, so that's why the talk was on the base level.
I agree. It was
We
just a,
have planned some workshops where hands-on workshops are there, where we'll focus on apps and how to use it.
That
I
will
agree.
be.
I agree.
Thank
It was
you.
a settled. One, sir,
Thank you very much.
one last comment, sir. One last question,
Yeah.
if it is. What is the question? It is not a comment. Question about what is the possibility of having an AI as an employment for surgeon, specifically in respect to conversion of unstructured data to a structured data?
We can do it, sir. Already the EMR is the most used AI tool in healthcare, sir. So the HR and the management is using relying on AI for that part mainly, sir. So because digitalization itself will take a lot of time, and by AI the digitalization itself will take only seconds. So earlier we used to scan all the things, and now you just take a photograph and that is done. So that is the main thing which is being used, sir, currently.
Thank you.
Yes.
Yeah, now it's time for comments from chairman.
Ma'am.
KSCASI.
Unmute. Dr.
Madam.
Nos, unmute.
I think AI should have reminded me that I should have unmuted. Thank you. Thank you, Dr. Sunil. It was an excellent talk.
Thanks, ma'am.
And you have, at the end of your presentation, shown us that it is definitely not a hype. It is definitely a help for all of us. And it will not replace us as surgeons. And it is definitely going to give a helping hand and make a superhuman out of us probably in the coming days. And if the fact that it can help us predict complications, maybe there could be a zero error in the operation room. That is one thing. And one thing we have to know is the gut instinct and the AI. So will that remain the gut? And if they collaborate, it's good, or will it diverge? So that is what we have to see, and that is what we have to ponder in future. And before I conclude, I would like to say that it is like AI is like a flower you asked for, but without its fragrance. So that is
Yeah.
what
Yes.
it will give you at the end of the day. That excellent
Nice
talk.
example.
And yes, and thank you, Dr. Shivaram sir, for the excellent moderation, and all the participants, Dr. Tanga sir, valuable questions and inputs from your side too. Thank you all for participating. Over to you, Dr. Sarvesh.
Sir, you're on mute, sir.
Yeah, it was very nice. Yeah. Sunil.
Yes.
Sunil Joshi. Sunil, anything else to comment?
You're on mute, sir, again.
Good evening, sir. It was a wonderful talk, and I think everybody enjoyed it. Also had lots of comments and other things to make about. I thank the chairman, Shivaram sir for moderating the session, Sunil for a wonderful talk, and all the participants for their contributions and comments. Thank you, Sarvesh sir, for giving me as the in charge of this program. Thanks, one and all.
Yeah, it's over to Dr. Gurubasan Gowda, our treasurer, for vote of thanks. Hello.
Yes, sir. Yes, sir. Good evening. First of all, I joined a bit late because of my commitments. I'm really extremely sorry for that. But after going through the news talk, I definitely understand artificial intelligence will be the maybe or will be the future where we can have an assistance in our daily day-to-day practice and improve our preciseness as well. We can take it several. And how can we include in our daily practice? It is left to the health practitioner who practice. It was a wonderful talk, Dr. Sunil. Thank you very much for being with us for the association, giving this such a nice lecture. Thank you very much, Dr. Sunil. Shivaram sir, you did a wonderful job as you are always. Thank you very much, Sir Sunil. Thank you very much. And thank Naj madam for making this program to come upon and give us an inputs by leading from front. Thank you very much, ma'am. Subhash sir, thank you very much for helping us conduct this Zoom meeting. Thanks one and all for all these members and participants. Thank you very much. Good night.
Thank you. Good night.
Thank you, ma'am.
Thank you. Good
sir.
night. Thank you.
Thank
Good
you all.
night.